Good morning, I'm Jeff Stauffer, and thanks for joining us for another edition of the Elville Webinar Series. It's Thursday, March 27th, and the Terps are in the Sweet 16, so it's a great day. And we have a real treat for you. Our topic for today is housing options as you age, and your presenters are Victoria Hathaway, Certified Senior Real Estate Specialist and Director of Silver Group of the Bob Lucido team, and Emily Leclercq, Program Manager with Maryland Access Point and the Office on Aging and Independence for Howard County. So a few housekeeping items as we get started. We always encourage your general questions throughout, so please note them in the questions panel or chat, and we'll pause periodically to address them. And your questions always add a lot of value. They help others learn. If you have that question, somebody else does. So thanks in advance. And yesterday by email, you received the presentation slides Victoria and Emily will be referencing, and these materials are also available in the section marked handouts in the panel on your screen to download at this time. And we have some professionals on today's webinar. Welcome to you as well. Most everyone may receive 1.5 continuing education hours for attending. So if I don't have it already, please send me your ID or your accreditation so I can submit those hours for approval and also send certificates out. Also, everyone will also receive a post-webinar feedback email right after the presentation. We always appreciate you taking just a couple minutes to fill this out. Let us know how we did. Tell us other topics that you want us to revisit on our webinar series. And so it's very important for you to share that feedback with us. Question for you. Have you achieved your planning goals, or have those goals shifted since you last looked at your planning? And here at Elville Associates, we're a resource for your families and your planning needs. And whatever that might be, if you're starting from scratch, if you have older documents that you haven't looked at in 20 years that need to be addressed, we see that every day. An administration matter or question about housing, for example, we are here to meet you and answer your specific questions, understand your situation, and create some solutions and a path forward for you, as we like to say here. So Victoria, welcome back. It is great to have you here as always, and welcome to you, Emily. We are really grateful for your time and your expertise today. So I will turn it over to you.
Yeah, great. Thanks, Jeff. My name is Emily. We got Victoria. We're going to be kind of tag teaming today. And housing is one of the major things that I talk to individuals and families about on a regular basis. And well, with Victoria's role, and she is in the midst.
Yes, and it's great to be here and have Emily presenting. I had the privilege of going and seeing Emily do this presentation close to a year ago, more than a year ago. I thought that it was really succinct, really impactful, and you know, the public-private partnership of saying, you know, let's serve this up. So thanks to Jeff and Elville for providing the platform to get the word out. And Emily's going to be the star of the show today, leading us through all the housing options as we age. I will be kind of a knowledgeable peanut gallery, chiming in from time to time on various things. There's so much meat on the bones here. This, I feel, is sort of an excellent overview and also the tip of the iceberg, because each of these topics can really be pulled out and spoken about on their own merit. But I'm excited to be here today talking about this with all of you.
All right. So just wanted to share a little bit about the objectives today. We're going to be talking a little bit about why it's so important to plan. I talk to individuals about long-term care planning a lot, and housing is certainly one of those topics that everybody should be aware of as far as what options are available. We're going to go over the individual and different types of housing for older adults. We're going to give you things to consider. I'm going to talk a little bit at the end about the concept of aging in place, and we will share some more information about the cost or financial aspects of each of the housing options. All right, so in my role with the local Office on Aging and Independence, we're always trying to get people to plan for future needs as we're aging. And so one of those ideas is you need to plan for housing options as you age. Oftentimes, as we age, we're having changes in our physical health, emotional and social networks might change over time. And so we have to think about those changes and the importance of, I always say, thinking about the what ifs. trying to plan for the what ifs so you don't have to prevent making last minute decisions. When we're making some last minute decisions, it also can create a lot of stress, anxiety, and can cause people to make maybe the wrong decision because they need to make something really quick due to a health change or status. And some of the other things that we want to talk about and think about when planning is like health and safety considerations as we're aging. So if you're in your current home, thinking about, is your home accessible and safe for you right now? And if it's not, could you change that? Maybe make it more accessible, make it easier for you to get around in your home, or do you need to change to a different living environment? And we'll go over those housing options. But I'm going to probably stress this a lot throughout the presentation, the need and thinking about being close to what's important to you and your community, being close and having the availability of healthcare and social support as we age is so important.
Yeah, this is one I'll actually chime in on. Emily and I are on the same page. To be proactive instead of reactive is really the way to go, even if you're going to intend to stay put. You know, don't take your eye off the ball of keeping your home safe, keeping yourself safe. We have stories. Call us on Halloween and we'll tell you all the scary ones. To not be flat-footed with this is really the best advice, and I appreciate you putting emphasis on that.
Yeah, I'll just mention a lot of times people will call our office when they're in the midst of a health crisis or change, and now they're having to make really quick decisions, particularly around housing, maybe moving to an assisted living or a retirement community. And I'm often thinking people, if they could have just maybe done some research or education on these type of housing options in advance, it would have lessened a lot of people's stress. And the importance of like talking to your friends and family, your care team about what your wishes are.
Yeah, and grab bar, we're going to get there.
Yeah.
But, just even doing something as simple and proactive and preventative as a grab bar. You'll know if you needed it and you don't have it. And we've got the stories to go with it. So thank you.
All right, so there is a lot of things to consider. And so I will suggest individuals, like, where do you see yourself today? Where do you see yourself maybe 2 or 5 years or even 10 years or longer, depending on where you are? As we're aging, I mean, for my office, we consider aging 50 and older. Well, a lot could happen in that 50-year time period. Yes, we are all living older. So your needs will change most likely. So kind of putting yourself thinking about the big picture, because that can often prevent you from making poor decisions and having to make a lot of decisions or changes later. And again, I have it on my slide about the importance of making sure that you have the available support to you, whether that's community support, being close to things that are important to you. Available healthcare will certainly be something that you need to think about. And we are lucky in Maryland to have great healthcare system available. But if you're going to think about moving to another state or another community, I would suggest that you make sure that you're moving to a place that has good healthcare. And then thinking about, well, if you did need some assistance as you age, who would be able to help you? Would it be friends, family, your social network, neighbors? Where do you want to live? Do you want to change? Do you want to stay in your home? And then certainly finances and what you can afford is going to play a factor in these decision making. All right, so this chart is our way of trying to get people to see the big picture, to give you an idea of all the options, care options, housing options as one might age in the community. And so we're going to go over a lot of these housing options on this chart. It gives you an idea of like the level of care between them and how they might overlap, but also the amounts of costs associated with the care or the housing. And we'll go into more detail about some of these. All right, so we're gonna start with all the independent living options as we're aging. And so one of those options will be what we call an active adult community, or we might call it a 55 plus community. And really that's what's in the name. These communities are set up for older adults 50 plus to live in a community together. With these communities, I feel like they've grown. I've worked for the Office on Aging for 20 years, and I feel like when I started, maybe we had like a handful. And right now in Howard County, we have like 23 of these communities. So they've become really popular over the years. Often you have to work with a realtor to purchase the home. They could be single family homes, they could be attached homes like a townhome, or some will call them villas. And then there will be condos. So there's going to be different type of housing options within the campus or community. And what people like these communities, because the idea is there's low maintenance involved. The community is providing you that maintenance of the exterior of the home, and then kind of letting you just be responsible for the interior maintenance of the home. With this though, because of the exterior maintenance, you will be paying some type of homeowners association, and it would be important for you to find out what that might be over time. And the benefit of these communities is they're offering you a lot of different amenities, such as some might have a pool, community center, gym, activity space to encourage community members getting together.
Yes, my chime on that of you don't know what you don't know would be lots of times we're talking to people who ultimately, after selling their home that they raised their family in, have been longtime homeowners, single family home, they want to maybe do a chapter in 55 plus, and then they possibly have a goal to move to continuing care retirement community where you come with that larger cash buy-in. And I've really been excited to see financial advisors, attorneys, people. Emily, she can say, you need to watch the money, and you need to make sure that you understand there are costs to buying and selling and going to closing. And I actually had somebody where the financial advisor said, you are not going to be able to recoup after the cost of buying and selling. If you do the 55 plus chapter, you should go directly to CCRC and not try to do this in between keys. So, it's that all depends kind of conversation, and it's really amazing to have a kind of a parent-teacher conference where you're saying, let's really look at your situation and make sure that you're going to be making all the right decisions and to do the risk management. The other thing I would say is a caveat on if you're going to a new build community, the person who's sitting the desk for the builder when you're going in as a buyer, they might be wonderful, but they're not going to be your advocate the way that a realtor working for you is going to be. I have a story about a person who came with, it was a gray divorce situation, and they took their half of the sale of the family property, and they were very excited to go buy a new build in a community. And they were guided by the builder's representative, who sold them the property that, if you had looked at the general plan and done the homework, that's where they cut Route 100 through and put the big wall and raised the forest flat. So that individual thought they were buying the nicest property in the community. They were guided, and it was a bum steer. So just, words to the wise, and I'm here to make sure nobody gets hurt to the best of my ability. So yeah, thanks for letting me share that.
Emily, can you provide a question from the audience? Can you provide, or is there a list of the 23 active adult communities in Howard County?
Yeah, so on our website for the Howard County Office on Aging, we do have a list of the 55 plus active adult day communities, along with the independent apartment list for older adults and retirement list. And if you live in a different county, most of your local Department of Aging will also have similar lists.
Okay, thank you.
So if you're, Victoria already gave you a lot of things to consider when looking at a active adult community, and see, these are some of the additional things that you can think about. Think about the size. Some are smaller, some are larger. What's important to you? It's really a personal decision. My mom moved into a community, 55 plus community, about 18 years ago. She's been happy. She moved in when she was still working. Now she's retired. And she really liked the idea of not having to do yard work or keep the home and have to worry about like snow and things like that. Things to consider, though, would also be the age restrictions. In these communities, the owner often will have to be 55 and older, and they often do not allow children to stay for long periods of time. Just a personal example is in my mom's community, her neighbor moved in, lived a couple years, and then her daughter ended up having to move in with her, and her daughter ended up having a child, and they ended up having to leave the community because now there was a child living with them and they couldn't remain in that home. So just something to consider, you and your personal and family situation. You definitely want to know about roles and restrictions. Try to get a copy of the bylaws of the community that you're looking at prior to going to closing would be very important so you know what to expect. What amenities are important to you? Like if a pool is really important, then maybe just concentrate on the ones that offer that amenity versus some of them are not going to be able to offer all amenities. And then be aware of the homeowners association fees. What's included? What's the current fee? I say that because oftentimes those fees will go up over the time, and it would be interesting for you to be aware of and know what to expect, how the fees have changed if you could get that information in advance. So you can better prepare for financially those costs.
Yeah, I love it. No surprises.
Okay, no surprises. All right, so another type of independent living option would be looking at older adult independent apartments, age-restricted apartments. In our area, they're going to either be for those 55 or older or 62 plus. And these are independent apartments. Everybody's independent. You have your own space. You come and go, do what you need. The idea is these apartment complexes are more accessible with an elevator. They often will have some type of security where you have to be buzzed in. And in our area, I would say there's going to be market rate and moderate priced apartments. And market rate in our area would be anywhere, I would say, 1,700 to 2,500 plus, depending on the size of the unit, 1 bedroom, 2, 3 bedrooms. Or moderate priced apartments in our area is going for around 1,200 plus, again, depending on the size of the apartments. Within these communities, they will often have some type of community room where they're encouraging the residents to have and host their own activities. Some of them will offer a pool, a gym, maybe a computer room, and I even have seen where they have like people come in and provide like salon services in-house. And again, people like these because they're going to be accessible with some type of elevator to get to their units. And then some of them will have type of accessible features like grab bars, pool cords, and the bedroom areas.
Yes, my 2 cents on everything that Emily's going to be talking about pretty much from here forward is going to be, don't assume that when you are ready that there will be inventory. Places are popular, places have wait lists, places have VIP wait lists. And we just want to make sure that you're not assuming that when you finally are feeling like, okay, in the next 2 months, I'm going to make the move, 6 months, a year even. So do your homework, visit the places, dial in on what you think is going to be the right thing for you. And then, rally your courage and have the conversation with the team there on site and ask them, you know, what is the wait list? What is the inventory situation? I am sad when people say, you know, I'm all ready to do it, and I realize that I've signed up now. I'm on a 6-month, 8-month wait list. And sometimes, you know, life and wellness and lifestyle are so good in the communities that the turnover is slower than predicted, which is like a really happy thing once you're in, but it's a really sad thing when you're on the outside and you're all queued up and you're waiting and waiting. Maybe you're going to sell and you hoped you weren't going to be selling in the winter. But then when they say your turn is here, your number's up, that's when you go. So just, you know, again, to be proactive and some words to the wise.
Yeah. I just wanted to mention there are subsidized independent apartments in our area. These will be the most affordable apartments. Subsidized apartments, the rents will be generally based on one's income. And the thought is about like 30% of your income. Some of the apartment complexes might offer apartments that are either 30, 40, 50, and 60% of your income. We have in our area where the entire apartment complex for older adults is all subsidized, or some of the communities might have a few subsidized apartments within their complex. So oftentimes it's important, if this is what you need, to reach out to as many of these complexes as possible, because I will say most likely they're going to have some type of wait list for the subsidized apartments in our area.
Emily, question from the audience. I think you just alluded to this, but want to confirm. Do you own the independent apartments, or is this a renting situation every time?
Yeah, so the independent apartments are going to be your renting, so you do not own them. The 55 plus communities are going to be where you own them, and they're going to give you options like single family, attached, or a condo type of living arrangement.
Great, thank you.
The last independent living community or option I want to share is about retirement communities. So these are going to be communities that offer maybe one type of living, like independent living, but often they provide independent living and assisted living options all in one community. In these communities, they're usually secure, they have staff there on site to assist, some type of security, they're greeting and welcoming all visitors. And within these communities, they're providing you maybe some supportive services. They would be offering some type of meal plan on their campus. They'll be providing like wellness activities and programs, other amenities like pools and outings and trips. And so within these retirement communities, you are again a renter. You are paying a monthly fee to live in the community and have your own apartment or unit. And then if you were in the independent part of the community and later on you needed assisted living and they had that on their campus, then you could move into their assisted living versus having to move out and go someplace else. So as we're ending independent living communities, the 55 plus, the senior apartments, and the retirement communities, these are just some things to take into consider when you're looking at them. One thing is location. I'm sure Victoria will say, and I do the same thing. Some of these places like the apartments are great and conveniently located to a grocery store and public transportation. And then there's some that could be out in a different part of our county or in the state that aren't close to those things. So thinking again about what's important to you and how are you going to get to these locations. Definitely going to need to know about costs. Think about what you can afford, whether you can afford a market rate, a moderate price, or if you need a subsidized unit. If meals or dining services are important to you, not all the independent options I shared provide you that service. So just know about that. But there's certainly, if you live in an independent older adult apartment, you could look at other options like Meals on Wheels or a meal delivery service. If you have any pets, you would want to know if they're pet friendly. Some of them might have a criteria on the size of your pet, so that's something to be aware of. Are there any activities that you would like to partake? Do they offer that within their community or campus? All right, so we went through all the independent options, and I'm gonna start with the life planning community, because, or some people might call, the older term has been known as continuing care retirement community. And this is a place where you have one single campus generally, and they offer all 3 levels of type of care, continuum of care. They're going to offer independent living options. They're going to offer assisted living and long-term nursing home options all within one campus. So individuals often would like to move there because they like the idea of peace of mind. You're moving, you're not going to have to move very far if you did need additional care in the future. And the idea around these communities, it's really focused on lifestyle, making your life easy by having a lot of amenities all in one location. So, and it's almost, in some of these, the larger ones can be its own little town. They'll have a little grocery store, dining room options, pools, fitness center, gardens, their own medical staff on medical center, occupational, physical therapy services, all within one campus. And so with these, you might need to pay an entry fee to get into the community. So you're going to put some type of entry fee down. And then in addition, you're going to pay a monthly fee on top of it.
Yes, I'd like to give it 2 cents on that. Sometimes storytelling can be helpful. This happens a lot, but one visit that I had sort of sticks out. The people had chosen the CCRC. They knew that they were going to do it. We came to visit and talk about their property and their timetable for selling. And they said, you know, they've got it all figured out and they want 3 more holiday seasons in their home before they make the move. And so, you know, I said, you do understand that until you're in, you're not in. And until you're in, you're not covered by the umbrella of care that you'd be buying into. And they said, yes, we understand. And I said, further still, do you understand that if you experience a health diagnosis or have a health event before you go in, that could potentially disqualify you from being able to clear the health hurdle to go in? And, you know, the long and short of it was they sort of felt like the sales team at the community was doing a false urgency sales tactic. And I think they didn't really believe that that was the truth. And so that is a truth, and it can be a hard truth. In their case, they decided to accelerate their plan for moving in. They felt that they were playing Russian roulette the longer they stayed on the outside. It's very sensitive stuff to talk about, and you know, just to be able to talk from a fact-based perspective and to not have people off thinking wrong things. And Emily and I had a good conversation about this as we put the presentation together. Also, just inventory. People, they told me, you know, well, we're ready. We have the health and we have the wealth. And I thought, well, good for you. That's phenomenal. But the community that you have chosen doesn't know you're coming, and they may not have inventory on your timetable. And then it becomes sort of a loop. So do you have anything to say? I mean,
yeah, I have worked in one of the continuing care retirement communities. So I think we'll move on to the next slide to give you some of the things to consider. These are some of the things that Victoria and I spoke about. Definitely, you know, when you're looking at these communities, be aware of the contract and fees associated. Some of them have different models when it comes to their payment, their entry fee, what the monthly payment will be. What will the fee be when I move to the next level of care, and so on. So just making sure that you read your contract, know your rights, and whatever fees are associated and how's that fee refunded later when you move out of the community. I think it's important to know and think about the size of the community. Some of them can be quite large, some of them are a little bit smaller, and some are like one building. So think about what you can handle when it comes to size. And when I worked in one of the communities, it was a larger one, and I was just trying to get people to think about the location of the unit, the location of your apartment. How far is it going to be to the things that are going to be important to you, like the dining room or to an activity center, or if the pool is important to you. Think location, location, location again, because as you're aging in these communities, you might have issues with your health, you might need to use a mobility device, and it might get harder to get to some of those locations over time. So think about that. In these communities, oftentimes you're coming into the independent part of the community, and then you might need to transition to another level of care, like the assisted living part or the nursing home part. And I personally would want to know, how is that decided? Am I the only one that gets to decide when I move to the next level of care? Or is there like a community, encouraging to me or determining when I might need to move? Again, amenities, what is important to you and what is included? And another thing to consider is maybe, can I bring my own care to my independent apartment? Can I hire my own in-home care agency or individual that I've known for years to provide care to me over time, or my own cleaning service that I've been using in my single family home? Can I bring them with me? You would want to find out, can you bring your own type of care versus if you're required to use the care that's provided within the community. And I think Victoria and I will agree is like visit and go at different times. Visit, certainly go to the marketing events, they're great, but try to go, and if you have friends that live there, experience a little bit of time with them so you get a sense about, is this the right fit for me?
Absolutely agree with that. Not everybody, gets to or got to go to college. Sometimes a good analogy is, do a comparative study, take the time and energy to look at more than one. I think it's just as important to know what you don't like and what doesn't feel like a fit as what you do like. And if all my friends are picking University of Maryland and it's the College Park campus, if that's overwhelming to me and too big, you need to know yourself and know what is going to be the right fit for you, because it is a big undertaking to do this process. And just like the college counselors don't want to have the freshmen wash out and be unhappy, the sales teams really want it to be a good fit. They don't want it to be a mistake, just get you in and have you be unhappy. So, I encourage you as individuals to step up to that challenge and really do the time and the education ahead of time. Sit, let it marinate, make the right choice, kind of a tortoise and a hare type of approach.
Mm-hmm. For sure.
Can we pause for a couple of questions, Emily and Victoria? Yeah. All right. First one is, my experience in the DMV now is that the CCRC wait times when you apply are around 5 years. And as you say, will your health stay good so you still qualify after 5 years? So what do you advise on home sale? Is it better to wait until you agree to be in the CCRC, then sell?
Wow. It's easy to say it all depends. I would say, probably need to have a bit of a deeper conversation. And I've seen people do it so many different ways. So just off the top, there's an example of people who are concerned about the market, they're concerned about going through the selling process, and they opt to do the home sale. Sometimes the agents will call it, they took the money and ran. get it done, liquidate, have the pile of cash. This is going to be a segue back to Jeff and Emily, because then I'm having concern about there's no longer a real estate property that's owned and the money has been, liquidated out of it. Then I'm very concerned about, spend down, and there's a health crisis, and then you're paying all your money and that money is sitting there and it's no longer protected by a piece of real estate. So that's definitely a presentation that Emily can speak about, and also Jeff. Asset protection, Medicaid spend down, all of that, and how that keys into whether you own property or whether you don't, and what's happening with your cash, your assets. I had somebody who knew that they were going to be going in 1 year. They sold very intentionally and did take their money, and they did a furnished rental for 12 months nearby, so that they just put everything in storage. It felt like they were only moving once. They just had a year-long interim where they, had their pajamas and their toothbrush and what they needed for the 4 seasons of clothing. I've also had people who say, we're going to just hold tight and just continue to let our real estate appreciate and make our way through the wait list. So again, things can change for you, your health, the real estate market. Things can change at the communities. Sometimes, they're actively building, or they'll have, pandemic was a big game changer. So, the future is the future. We'll have to see. But, just to kind of muddy the water and be willing to talk about all the aspects that we could talk about, we relish in those kind of one-on-one conversations. So happy to do it. But it's a great question.
Well, thank you, Victoria. And you kind of alluded to this. So our next question is, as you move up in levels of care, and if your resources start drying up, does Medicaid cover the expenses of life plan communities?
Yeah, so when you are often looking at the life plan communities, they're often evaluating you, like your health, your financial situation, to make sure that you can financially support yourself as you move up in the levels of care. When it comes to the life plan communities, one of the selling points is they might say, well, we'll take care of you even if you run out of your funds, and we have like what they call benevolent care funds set up to help supplement that. When it comes to moving to the next level of care, like assisted living, that would not be an option, and I'll talk more about that in assisted living and Medicaid. But nursing home option, yes. If a person, it's possible that if they meet the criteria for nursing home level of care to get Medicaid. But again, these communities are doing their research on you to make sure that you can financially support yourself as you age in the communities and move within the levels of care.
Yes, and my 2 cents on that would be something that I'm very, very passionate about, have written about, have presented for Jeff and Elville about, and that is the idea that realtors can do your sale transaction in a way that is bad for you in a fiduciary sense. They can essentially make more, and you can make up to 6 figures less on your property sale. And what that has to do with this conversation is then when you do move into continuing care retirement community, and my grandmother certainly lived to 105, and she was in pretty good shape, that you can live long and then you can be spending down. The idea that you would come in as financially robust as you could, and that real estate sometimes can make that happen in the extreme good way, and also it can happen in a bad way. And that's a whole different presentation, but it ties into how fast am I spending down, how much did I come in with, and that financial assessment is real. And to be able to help or hurt people as far as the financial qualification, that's a whole nother conversation.
Okay, thank you so much.
All right, so we just went through all the independent options, and sometimes living in our own home, living in a condo, apartment, or even a retirement community might not be enough. And so the next level of care would be an assisted living facility. And certainly the continuing care retirement communities have this type of living arrangement as well. But then there are going to be just assisted living facilities out in the community freestanding. And these are really designed for individuals that may require some medical or personal care with like help with bathing, dressing, grooming, but don't require that 24-hour nursing care that one might need in a nursing home. Maybe they require some supervision and assistance with some of their activities of daily living on a daily basis. And so these facilities, care options offer all that type of assistance when they need it, in addition to like meals and medication management, maybe a visiting by a nurse or a doctor, all within one facility. But assisted living providers do vary, and I'm going to go into a little bit more detail about how they vary. But some of the things to think about is the size. We have larger assisted livings and we have smaller assisted livings. Depending if you're in a larger one versus a smaller one, the staff on site can vary. Certainly, again, we'll come back to location. Some of the larger assisted livings might offer amenities. There are going to be different options when it comes to a private room or a semi-private room. And some of them might have your own bathroom, but then some of them are going to offer like a common bathroom where you're sharing with another room. The levels of care within the facilities, I would say most of them are going to provide all 3 levels of care when it comes to assisted living. And then also, ask questions about like, what is the schedule? Do I have to get up at a certain time? Do I have to go to bed at a certain time? Are there visiting hours? And all these will help determine what might be the best option for you. And let me give you an example. All right, I'm going to break it down even further. So we have larger assisted livings, and these are all photos that I've taken off the web associated with a larger assisted living. These are going to be generally 17 plus residents. For the most part, they're going to be corporate owned and operated. And as you can see, they have this very nice posh hotel facility feel. And generally in these type of facilities, if you're in like one of the larger ones that have like 50 plus residents, you're going to have your own like unit, apartment, and your own bathroom. But the idea is trying to encouraging you to come out of your apartment and partake in activities and programming and have your meal in the dining room. And then you'll find in the community, we have a lot of smaller assisted livings. I say these are going to be more like 1 through 16 residents, but typically I would say they're going to be like 4 to 8 residents in a home, depending on the size of the home. These are going to be more in a house-like setting in the neighborhood. You might have one in your neighborhood and you don't even realize it. And generally, these are going to be operated by a single person who maybe owns one home, or they might own a few homes in the area. Just to give you an idea, in the Howard County area, we have about 70 plus of the smaller assisted living. So we have quite a few that people don't even realize that are available. So when it comes to assisted living, oftentimes people want to know the cost and how much is it going to cost them and what they can afford. So basically, assisted living costs are going to be based on the amount of care or services provided to the resident. So you're going to pay a monthly fee at the assisted living, but there could be a range in that monthly fee depending on what type of level of care is required. So there could be a range within that facility. And then in the average cost in our area is about $6,700 a month. And I gave a range because some of the smaller assisted livings might be a little bit lower, around starting at like $3,500 a month. whereas the range in the larger ones can even go as high as like $8,000 a month. So huge range. Definitely need to know what you can afford over time as you're living and residing in an assisted living, because I always like to make sure people are aware you might go in at one assisted living fee, but there's a good chance if you're aging and you're requiring more assistance, most likely that monthly fee will go up. So it's important to think about your finances over a long period of time. Some of the larger ones, and I've seen some of the smaller ones, require or charge a one-time entry fee. Medicare does not pay for assisted living. I probably get that question at least once a month. Medicare is your health insurance. It does not pay for housing, and so it does not pay for assisted living. When it comes to paying for assisted living, individuals will be paying privately. They'll be using their income, like Social Security, pension, their resources, the sale of their home, retirement plans, savings, stocks, bonds, annuities, all that's to use towards paying for the assisted living. And then there is some limited programs within the state and your county that could help reduce the out-of-pocket cost of assisted living. Even with those programs, you are still going to use your own income, whether that's Social Security or pension, to go to the assisted living. And then the county and state programs would basically be helping to supplement the cost. And I will say that right now, the majority, if not all, of the programs will have some type of waiting list. There are other ways to pay for assisted living. If you have a long-term care insurance policy, definitely know what your policy will cover, that it could cover assisted living. Or if you're a veteran, there's the aid and attendance program through the VA. And if you're a veteran or a spouse of a veteran, that program can be very helpful. We used it in my own grandmother, and boy, it was a lifesaver to be able to apply for the aid and attendance program through the VA.
You read my mind. I don't see it on the bullet.
Yeah.
This is sort of a Jeff and an Elville and an Emily conversation, but everywhere I go, I am very passionate about making sure to at least mention it, and that you can, kick it to a higher level with your research, because this is absolutely something that exists. And I learned about it as the daughter for my own dad, and he had Alzheimer's, and we were figuring it out. My parents did divorce. So if my mom, who needs help now, can't access it because divorce severs the ability to get that. And I think when I first started, there was no financial look back, but I understand now there is a 3-year look back that's in place to qualify for that. But I have definitely helped people who've not only gotten it, but who've even gotten it retroactively. So there is some good news about that. I'm thrilled that you're mentioning that.
Yeah, and then when it comes to the county or state program, there will be income and asset guidelines for those programs. So just be aware that there are times where people's income is too high for the programs. And so that will play a factor in knowing what you can afford for what type of assisted living, whether it's going to be a larger one or a smaller assisted living. So things to consider when you're selecting an assisted living is, one of the #1 things will be cost. What can you afford now, and what can you afford over a long period of time? Because most likely, like I said, as your level of care, your needs increase or change, most likely that monthly fee for the assisted living will change as well. So take that into consideration. An example would be, sometimes I get calls from individuals or family members generally where they're like, my mom's been at this larger assisted living for 7 years and they're running out of funds. How am I going to continue to afford it? And that's great. That tells me that assisted living is providing really good quality care. But the reality is, if your assets are depleting and you can't pull any more resources to help supplement the cost, most likely you might need to move to a different assisted living, one that might be more affordable than the one that a person is in. And I hate having to bring that up with individuals since they're very happy with their care. The programs that are out there to help with the cost are limited. Again, income and asset guidelines. And again, you need to consider like what's important to you, larger, smaller, the amenities, and it really comes back down to like what you can afford. I really encourage people to, even before you need assisted living, is to visit a couple in our area to get a sense about what you like or dislike. Because if and when you need it, oftentimes it's because of a medical crisis. And it happens very quickly, maybe after a hospital stay, and the person can't return back to, say, their home in the community or their independent apartments. And then family often are having to make really quick decisions. So if you already had an idea of something or a couple that you liked in advance, that would make a huge difference in finding an assisted living during a crisis.
Good advice.
Any questions about assisted living, Jeff?
Not as of now. Thanks for checking. I'll keep you posted.
All right. So we're gonna, next level of care type of housing option would be a nursing home level of care. And nursing homes in our area will provide you long-term care services. This is a place where individuals might need to stay there as a long-term care resident. They need ongoing medical care that needs to be overseen by nurses and a physician, and maybe more higher skilled, complex physical or mental health diagnosis or need. And this type of environment too, a lot of the nursing homes in our area will also provide like a short-term rehab skilled reason to have care, where individuals might come into this facility after a hospital stay. They can't go home yet, they need rehab or skilled nursing services, and they'll stay there for a very short period of time, and then when they've recovered, they'll move either out of the facility back to their home or to another level of care.
So we do have a question about this, so maybe wanted to clarify, but question is, how welcoming are these outfits with working with long-term care insurances? I'll assume she means the nursing home care. They can touch on both.
Yeah, so if you do have long-term care insurance, that's great. Know about your policy, read it, know when it can go into effect and how much coverage it will provide. Every policy is different. And then most assisted livings and nursing homes will accept long-term care insurance. But again, you do need to know what your policy is and work with your policy provider directly regarding what they need to determine when they're going to start providing that coverage. Nursing homes in our area and rehab centers, I just wanted to give you some resources and things to be aware of to help you make decisions. There's two great websites. There's the Maryland Healthcare Commission and the Medicare website. Both are websites where you can compare these facilities and you can see the most recent survey results through the state of Maryland. You can see how they're rated to give you an idea of which ones might be a good fit if you did need this type of care. I encourage you to take a look at some of these websites. You can search by your county, you can search by your zip code, and it's good to be aware of what's out there, only because if you ever need to be in the hospital, and you're there and you need this type of care upon discharge, oftentimes the hospital staff will be asking you, do you have a preference? Is there a certain one that you want to go to? And people are often like, I don't know. Now, just because you have a preference, I should say, doesn't mean you're going to get that one. But if you already had an idea based on looking at these comparisons on the website, or even talking with your friends and family about like where they've had really good experience with rehab stays, at least you would have that information in advance. So I encourage you to do some research when it comes to that. Yeah, it's on my desk. We're gonna get a power cord because apparently we're gonna run out of power. I'm down the hall. All right. So other resource I want you to be aware of is if you're ever in one of these facilities as a long-term care resident or family members in there, or if you have a rehab stay, is know about the long-term care ombudsman program. Every county has this program. They are your advocate. If you ever have care concerns or issues within these facilities, the nursing homes and assisted living facilities, the long-term care ombudsman workers can help you with some of these issues. They know the regulations. They're out visiting these facilities on a regular basis.
Can we pause for a couple questions, Emily? All right. I'll first say, personally, I met the long-term care ombudsman program at last year's Brain Injury Association of Maryland annual conference, and I didn't know much about it. I was amazed at how much information they can provide and a resource for people looking or that currently reside in these types of facilities. So, having said that, a couple questions here. First one is, my husband was moved to memory care within days of entering assisted living at a cost increase of 50%. Is a CCRC the only option for us to be together? And how often do people move facilities for cost, other reasons, and how disruptive in general for the person moving? I also wish we had gotten a more thorough evaluation before moving. Ours was just a Zoom call.
Yeah, that's why I mentioned in the assisted living, certainly knowing about care, your options and what you can afford over a given period of time to prevent the idea of having to move again. Particularly, like you said, if somebody does have a diagnosis of dementia, Alzheimer's, some type of cognitive impairment, any transition is hard for patients with dementia. So if you can try to prevent that as much as possible to change anything. Yeah, not all facilities have a memory care unit, and so, ooh,
Hey there, looks like we're getting the power adjusted on Emily's computer, so hang tight for just a minute. Thanks. While we have a minute, I would start singing for you, but I know nobody wants that. So great information so far from Emily and Victoria. Lots of answers that may pose some more questions for you. And if you do have those questions, obviously Emily and Victoria are great resources, and I'll be sharing their information again after the presentation. And you can always reach out to Elville and Associates with that information and questions as well. So it looks like Victoria's calling me. 1 second, and we'll be back. Looks like we are back. Emily, let me know if you can hear me. Hang tight all, we are still working on it. Appreciate your patience.
Taking yourself off mute.
Can you see us? Hear us? Woo!
All right.
Sorry about that.
Emily and Victoria, that was the perfect webinar until that moment. We've never done one yet, so we're gonna have to keep trying. So
We'll just have to do it again.
we will. All right, please continue. Thank you so much.
Great. So I just want to mention 2 ways that people will use their Medicare benefit to pay for nursing home type of care, and then I'll mention Medicaid. So Medicare does pay for nursing home type of care as a short-term skilled care service. So if you are in the hospital, you can't return home back to the community yet, and you still have a skilled reason, a skilled nursing reason, or skilled physical therapy, occupational therapy reason, you could go to one of the nursing homes, rehab centers, and get that service covered under your Medicare benefits. Medicare does have strict conditions mentioning you need to have a skilled reason, you need to have at least a 3-day hospital stay, and when it comes to Medicare, they'll pay 100% for the first 20 days, and then they'll pay another portion 21 to 100 days thereafter. I will say, I always say, don't think of it as 100 days. That's not guaranteed, not one bit. You always have to have a skilled reason for why Medicare should be paying for a nursing home rehab stay. So oftentimes it will not be the full 100 days. The facilities will be monitoring your care and trying to decide if you continue to have a skilled reason to be there. And so just be aware, because that will certainly play a part on your discharge planning and when you might need to be discharged as a rehab nursing home short-term stay resident. Medicare website has great information about what your Medicare will cover when it comes to a skilled nursing facility care. But then oftentimes if a person is requiring a nursing home stay for long-term care, meaning they're going to now be at this facility long-term because of their needs, then people will use their income, their resources to help pay for their nursing home care. But sometimes over time, or people don't have enough resources, they might not be able to cover their nursing home stay. We met in the other slide, it said, you know, on the average, it's like 13,000 plus a month. So that's a lot of money. And so people often will need to apply for long-term care Medicaid or medical assistance to pay for their nursing home level of care. You do need to require that type of care in order for medical assistance, Medicaid, to pay for it. And you do need to have assets that is less than 2,500 and income less than the cost of care. And certainly there's different criteria financially if there's a spouse involved in the community. I could give a whole talk on this. This is just the basics. Just want you to be aware that that might be an option to help with the cost. But as we went over each type of housing option as we're aging, there's always the idea, and most people I talk to are trying to age in place in the community, age in their home, maybe their current home, or they're thinking about downsizing to something a little bit more manageable, like a condo. That's certainly aging in place, but it does take some planning. Again, I'm coming back to things to consider would be looking at your social engagement and remaining and connected to the community. We saw that during COVID, how important it was to be able to stay connected. You might need to consider, like, if you had some mobility issues or you could no longer drive, know what is available in your community around transportation options. And it does take some planning to make your home safe and accessible. Like Victoria mentioned earlier about grab bars, is like sometimes you can make really simple decisions, like getting your toilets that are higher, even though you don't need it now, maybe you'll need it in the future, getting the grab bars put in. Really simple devices out there that you can do now before you need it. I want people also to think about there's some planning involved when it comes to the upkeep of your home. Oftentimes I'll talk to my clients and they say, well, I don't have a mortgage. I'm going to live in my home as long as possible. But sometimes they fail to think about the upkeep, the repairs, the maintenance. Depending on how old your home is, are you going to have some major things that you are going to have to replace? That can be really costly. Sometimes people forget about like their property taxes in their mortgage, and now they don't have a mortgage and they didn't plan for how they were going to pay for their taxes during that season. So thinking about the upkeep also too, like if you did need help in your home, like cleaning or snow removal, yard work, can you do it? Will you need to hire somebody, and what resources are out there to get that? Again, talking about family and friends, your social network. Most likely as we age, we find that we are going to need some help from others. So taking that into consideration and making sure that you have friends, family that could help you if that time comes. Wanted to give you some resources to help age in place. I made this very general, so if you live in a different county, these are all services available across Maryland, but Maryland has a durable medical equipment reuse program. If you ever need some durable medical equipment to make your home accessible, this certainly is a really good resource. Some counties have their own loan closet or durable medical equipment location as well, so you could check your county. Like in Howard County, we have our own loan closet. Other things could be property tax credit. Maryland has their own property tax credit for anybody in Maryland if you meet the income and asset guidelines for the program. And some counties, we're fortunate here in Howard County to have some, we have an aging in place, a livable homes, and a senior tax credit to help with some of those costs. Because oftentimes your property tax is a huge expense as you're trying to age in your home. Think about home modifications. Are there things that you can do now to make your home more accessible? And think about supportive services, maybe researching and learning more about like in-home care options, transportation options, meal delivery. Maryland has a senior call check program that will call you just to check on you. and then your local village. There are villages out there across the United States and here in Maryland where they're usually a group membership organization where people are trying to age in the community, and they're going to support each other by helping when little needs come up, or they're helping and providing socialization activities to keep people connected. So check out your local village. They can certainly help you age in the community.
I like that you added that. Thank you.
Yeah.
I'm actually a big fan of that. I say it's community without walls.
Mm-hmm.
And I went back to Johns Hopkins University to study aging, and we had electives. And so one of the electives was a whole semester on village. And started in Boston, started in San Francisco, has become a movement, and it's a neat thing. This is an introvert talking, but you need your friends and your fellow man, you need your peer group, and if living long can be a lost narrative. People get sick, people die, people move to their grandkids halfway across the country. So I think that we need to be working really hard to do replacement intentionally when we lose a friend.
Mm-hmm.
And I feel like the village platform is a really neat, really functional way to get that done. And we're lucky to have one in Howard.
Mm-hmm.
There's one in Annapolis. So yeah, good stuff.
Yeah. All right, so some just takeaways as we end the presentation is how your housing plan is personal. You know what you prefer, what you will need, your social network, what your likes and dislikes are. So just make sure that you stay true to yourself. Sometimes I find that people will not focus on themselves, and they'll hear about friends or family moving to this community or that community or wanting to age in place. So they think now they have to age in place, or that they have to move to one of these communities. But focus on what you need personally. It is a personal decision. Think about some of the things that we talked about, things to consider. If you can do some research and education in advance, it's important to kind of do this planning in advance and have an idea for the what ifs. And then I really strongly encourage you, if you have friends, a family, social network, to please encourage you to discuss these decisions, because they're huge decisions to make with them, to get advice and just have a sounding board. Because they also know you, and so hopefully they can provide some guidance if making some of these plans or changes is what you need.
Yeah. Emily and I had a good heads together and kind of boiled it down to Aesop's fables. You've got the ant and the grasshopper, and the ant has food in jars, and the cracks are caulked, and they're ready for the winter. And that's that, high anxiety, plan A, B, C, Z kind of personality. And then you have the grasshoppers who are enjoying life, and they're out fiddling, and then the frost comes and they're knocking on the door. Be who you are, but have some insight into who you are. And if you need encouragement to plan, we are bringing you the encouragement today. You're looking at somebody who bought a station wagon before I got pregnant. So I love to have a plan A, B, C, and I see it every day in my work. Who knew when you meet a man who married a much younger woman, and the younger woman that he married gets early onset Alzheimer's? Like, we didn't see that coming. People who plan to move as spouses, and illness or bereavement changes the plan. People who plan to go to CCRC and then find out for health or wealth or whatever reason, plan needs to change. So just, it's great to have a plan, but I really, really love to see the plan B and the plan C, contingencies. And then when things are happening, and life does happen, it can really take a lot of the stress out of it. Even just to spitball and talk about these things. If there are kids their kids are involved, that's another place to have the conversation, and let them know your thoughts and wants. This is kind of spiraling into like an advanced directive or a most, or Jeff and all the estate planning that they do kind of conversation, because it all fits together. But just taking the time to think these things through and to mull even the housing piece of it that we're talking about today will kind of lead you organically down that path, and we highly encourage.
Yeah. So one of the resources as we end could be your local Department of Aging. In Maryland, every county has a Maryland Access Point program. That's what I do for our local Department of Aging. Our role is set up to provide information, resources, assistance when it comes to long-term care planning, knowing what care options are available, what you might be eligible for. We're a great resource. Our role is to provide you non-biased information so you can make the best informed decision regarding you and your situation. So highly encourage you to call Maryland, your local Maryland Access Point. We are a free service. I provided the link to go on to the website so you can find the number for your local MAP office. And most are available on phone, by appointment, in person. So please reach out to them for more information about everything that we spoke about today and more.
I send people to MAP multiple times a week. I've used it as a worker. I've used it as a family member. I am a raving fan of Maryland Access Point, and I've talked to people who didn't know, and they realized that all of that service was there, all the help was there, and they're really wishing that they knew. So it's great to be getting the word out. Thank you for what you do. And I memorized the Howard County number. So 410-313-1234, not a difficult number. And the folks that answer are so helpful. If you're in a different county, they'll help move you around through the system. But it is phenomenal and great to get the word out about it.
Yeah. And then just some other good resources is the Maryland Healthcare Commission. During COVID, they did a lot of great work out there that people aren't aware of. They created a long-term care toolkit to help people start the planning, start the conversation, understand your options. So you can go on their website and find that toolkit. You can find fact sheets on the different levels of care and be connected to searching and comparing the assisted livings and nursing homes in our state. Another great one is the Positive Aging offers a source book that you can go online and request one to be mailed to you, or you can see their online version. Great summaries on all different care options, including housing, and then you can find the list of the different options like the 55 plus, the independent, retirement, and assisted living options all in one resource book. All right, well, we thank you, and I'm so sorry for that technical difficulty we had, but we made it. Do we have any other questions, Jeff?
Well, Emily and Victoria, thank you so much. Such great information that I mentioned might answer a lot of questions, but also raise some more questions. So please reach out to Victoria and Emily, and they'll be very happy to help. I know that for a fact. So let's look at some more questions here, and then we'll end on time. Let's start from the beginning. Oh boy, some good questions here. Let's see. Let's see, I'm getting to it. Okay, so do you have any recommended resources for selecting long-term care insurance?
The best place to start is the Maryland Insurance Administration. So Maryland Insurance Administration is the main agency in Maryland then that you can find consumer resources for all different types of insurance. So car insurance, homeowners insurance, health insurance, and long-term care insurance. So you can go on their website. They have consumer guides. They have one on long-term care insurance. They always have the updated list of long-term care insurance providers in our area and some information about like how to choose. Do you use a broker? Do you not use a broker? All that information can be found on their website. That would be where I would suggest you starting.
Okay. Do you have any advice or info on aging co-ops in the area.
Yeah, I didn't mention co-ops or home sharing option. That certainly is a great option. Going back to like the Golden Girls, and in my county, we don't have that really as an option, but I think it would be excellent if we had more of those options available where people could co-share in one location and kind of help each other as we age. I know there's a movement out there that's starting to think and create more of those options, but I don't know much more to provide or where would be a good place.
Maybe check Silver Nest. I don't have it right in front of me, but Silver Nest, it's probably a .com. They are very intentional. That's what the platform is about. And I'm a bit flat-footed about whether there's anything happening, right here, Maryland, county by county. But you could probably take a look at that.
Okay. And a general comment, maybe you have a thought or two. I was told by a CCRC in Northern Virginia that they would not submit the claims for long-term care. The resident would have to do the paperwork. So it is not easy, not like a doctor's office submitting a claim for you. You will need someone to do the claims for you when you can't. Any feedback on that?
Yeah, I mean, that I could see that being an issue, that you are going to have to submit the claims by providing like what you are paying and getting that medical documentation. Other than hiring, like there are daily money managers out there that do certain things like that, that could be a possible resource.
Yeah, I love daily money managers as a professional class. Also, when you think about aging life care managers as a resource for that too, those are hired guns who essentially have the credentials that Emily has, but you can private pay and pull them in and help them, have them help you with tasks. They're an amazing resource as well.
Okay. Our next question, since there are multiple states in the DMV and PA, if you're in one state, is there any consideration in moving to another state?
The biggest thing, considering if you're going to move between states, is sometimes with your Medicare benefits, whether you have like an Advantage plan or a prescription drug plan, it's not automatically available in the next state. So if you do decide to move to a different state, you might want to reach out to every state has well, in Maryland, we call it the State Health Insurance Assistance Program, SHIP for short. Other states have it, might have to be a different name, where they have Medicare counselors that could advise you about what to do if you're moving to a different state, if those options might be available. The other thing is Medicaid is not across states the same. So sometimes we'll get calls of individuals who say, well, my mom lives in a nursing home in Pennsylvania. I want to move her to a nursing home, long-term care nursing home in Maryland, and they want to transfer the Medicaid, and that is not the case. So you would have to, once you become a resident here in Maryland or another state, have to reapply for like Medicaid community or even long-term care Medicaid. So those would be the two things I can think of on hand.
Yeah, that's a good, Jeff, I would put you on the spot for speaking to the importance of having your estate planning done such that it is state specific. And the thing that I would add would be in my realm, I've seen people go to sell their property. They were the aunt in Aesop's Fables. They were very proactive. They are moving to Florida. They already established Florida residency. Guess what? If you sell your property in Maryland and you are not a Maryland resident, you are going to pay for that privilege at a very high % of your selling of your profit at the closing table. So we've actually had people say, hold on, we're not going to go on the market. We're going to reestablish residency back here in Maryland in order to be a seller who's a Maryland resident at the time of sale. So that's a whole kettle of fish, and every realtor that's talking to anybody who's planning to sell should be dropping that flag early and asking, you're going to sell, are you a Maryland resident? That's a whole conversation. But then, Jeff, back to you as far as the intentionality about planning for the state that you are residing in for your estate plan. I think that's important.
Well, it is. I always have to say I'm not an attorney. I can't give legal advice. I've done enough of these to feel like I could do the presentation sometimes, but I'll say that it depends. It depends on how straightforward or complex your planning is and your assets. A lot of times you can move to a state and change what's called the situs or location of your trust. And sometimes it may be best based on your circumstances and your goals to revisit your planning and have it redone when you're moving. So it's really best to speak to an attorney. And obviously we have them here at the firm to give you that sound advice.
Good.
So let's jump to just a few more questions real briefly here. How often can you use that 100 days for nursing care?
Mm-hmm. So I always say Maryland Access Point, we do a lot, but the one thing I don't do is Medicare. So I would not feel comfortable because I don't work with Medicare on a regular basis. Great question. I would advise to go back to that document, that link I shared on the slide when it comes to Medicare, or also call your local SHIP office, the State Health Insurance Assistance Program, as they are the Medicare counselors and they are the ones that just deal with Medicare needs and questions.
Okay, and probably along those same lines, a question about, does Medicare pay for in-home hospice care?
So yeah, Medicare does pay for hospice services, so that is part of your benefit.
Yes, I wish we could do a whole presentation on hospice. I don't know how that would align with Elville, Jeff, but to not know about it or to learn about it too late to have the benefit. I did a whole semester on this at Hopkins as well, and became very passionate about it. I'm pro hospice, but I understand there can be cultural bias, there can be misunderstandings, there can be fear, but I really think that hospice is an amazing thing, and that it's free, and that it's there for the person who is suffering, dying, ill, but it's also there for the family and the loved ones, and can really be a phenomenal experience if you're open to it and want to learn about it.
Yeah, and you get the hospice benefit in the community, in your home. You can get it in assisted living, and you can get it in nursing home level care.
We actually have done a presentation with the executive director of Frederick Health Hospice about 18 months ago at this point. It was, to this day, I think one of the best presentations ever offered. And a lot to your point, wishing people had known about it. We heard that a lot, sooner rather than later. It's certainly something we can revisit. To answer another question here, yes, there are continuing education hours for this seminar. Send me your information. I'll be sure to get those for you. A couple more here. What's the easiest way to compare costs of different communities without visiting them all?
Yeah, I would say there's not going to be any easy platform out there that I've seen. You have a platform with Medicare to compare nursing homes. You have the platform for the Maryland Healthcare Commission to compare the larger assisted livings, 10+ resident assisted livings. And on that platform, they do put some type of price on there. Excuse me. But yeah, you might actually just have to create your own little comparison chart of what's important to you. Maybe start doing some research online, and then when you've maybe narrowed it down a little bit, then visit some of the facilities that would be most important. But I haven't seen anything great out there as far as the cost comparison.
Okay, so we have two more here, and then we'll go ahead and end. Could you repeat the resource Emily mentioned for long-term care? You recall that?
For the long-term care insurance, the best resource would be the Maryland Insurance Administration.
Okay. And last question, a really good one. Do all CCRCs require incoming residents to be healthy and independent when they move in?
I can't speak for all of them. Most of them that I'm aware of will do some type of pre-resident screening. mainly to make sure a person is independent. Back in the day, I used to do the pre-resident screenings in one of the retirement community or one of the CCRCs. And even if somebody was independent or maybe there were some things happening, we would have more of a conversation about like what the plan would be if, say, mobility became an issue, or if somebody was just recently diagnosed with dementia and they were still independent. We would maybe have like contingency plans about like what would happen if a person could no longer live independently. So a lot of them will have that pre-resident screening. And then a lot of them are going to, well, I would say probably all of them are going to do some type of financial screening to make sure that you have the finances to cover the community cost.
Yeah, Emily's going to run circles around me with that topic. I think I'm coming on helping 500 families make this move in my years. And one of the things I became aware of several years ago was there was a potential to move into a CCRC already diagnosed with, a health issue. They were able to go in paying like a rental format. They couldn't access the continuum of care, and they had to pay as they went, but they were able to go in and pay the fee, kind of come in the side door directly from the street into assisted living and pay in that format. And that caused me to really wake up and pay attention, because I didn't know that was a thing until, we learned about that.
Yeah, I've even seen where sometimes you could have your rehab skilled stay at one of the continuing care retirement communities. Yep. Because maybe they have a lot of availability in that unit on their campus, and they might work with individuals on the outside to just use that service for that short period of time.
Okay. All right, this brings our presentation to a close. Emily and Victoria, thank you so very much. I will send out information afterwards. I'll have that out by later this afternoon, including the video slides again, alluding to some of the resources that Emily and Victoria have shared, along with their contact information for further discussions. We have a lot of presentations coming up, including tomorrow, talking about achieving perfection for your legacy, being intentional in estate planning, as Victoria alluded to about being intentional just a few minutes ago. What exactly does that mean? We can find out tomorrow. And we also have our wellness series coming up on Tuesday, April 8th, our advisors forum on the 23rd of April, and also a discussion about special needs planning, financial and estate planning in unique circumstances on the 25th. So a busy time for the Elville Webinar Series, and I want to thank you all for being here. And Emily and Victoria, thanks again for all the great information.
Pleasure. Thank you. Thank you, everyone.
Go Terps.
Yay.